Okay, hi everyone. Can everyone hear me okay? Yeah, so I'm Dr. Kotari. I'm one of the craniofacial orthodontists. I work here with Dr. Glick, so some of you may have seen me at your orthodontic appointments. And I'm going to talk to you about what the orthodontist does, the role of braces in this whole jaw surgery process, okay? So let's see if I can figure out how to do this. So most everybody who has jaw surgery has braces before surgery. And the purpose of the braces before surgery is one, to align the teeth, to make all of the teeth straight, and then two, what's called coordinate the arches. So what that means is the upper teeth and the lower teeth separately should fit together. So some of you may remember having impressions done or molds done of your teeth, and the reason for that is we want to see how the teeth fit together so that after your surgery and when the jaws are moved, all of the teeth fit on both sides and you've got a perfect bite. So what things are done before surgery with braces? So that's the pre-surgical preparation. So sometimes we do some 3D imaging, 3D x-rays. We do a 3D plan like you see in the picture here, where the surgeon and the orthodontist will sit together and figure out how the jaws will be moved and where we'll put the bite so that you have the best possible bite that you can have. You'll also have photos taken, you'll have molds or impressions taken of your teeth, so that's some of the pre-surgical planning. The next set of pre-surgical planning is going to be some wires. You'll have wires put into the braces. These are passive wires, which means we're not necessarily moving teeth at this point, but we're holding all of the teeth. There we go. Now the mic's really loud. We're holding all of the teeth in a particular position so that we can prepare for surgery. You also have hooks placed onto the wire. So what does a hook look like? I'm going to show you a picture. So here's a picture of some braces and the wire going into the braces, and then those little hooks that you see in between the braces are called surgical hooks. And those look very similar to the ones that you would be having placed prior to surgery. Often the surgical hooks are placed about a week or two before surgery. The last one that's listed in pre-surgical preparation is called Paradex rinse. This is a mouth rinse that's often prescribed. It's antibacterial, so it helps reduce the amount of bacteria in the mouth and make the mouth more healthy so that the surgery can happen and less bacterial load, less likely for infections and things like that. Now you're all ready for surgery. You have your wires, your surgical hooks, you've got your mouth rinse, you have the procedure done. What happens after surgery? What is the role of braces after surgery? So the role of braces after surgery is to help the bite fit together. We can use the braces along with rubber bands to bring the top and bottom teeth together so that we perfect the way the bite fits. So elastics after surgery serve two purposes. One, bring the top teeth towards the bottom teeth. And I've got a little video to show you on what the rubber bands can do after surgery and bringing the top teeth towards the bottom teeth. So let's play this video. So you see where the teeth fit together, but the bite is open on the side, meaning the top and the bottom don't overlap. So you connect the rubber band, as Dr. Glick or myself will show you how to connect. And then gradually over time, the rubber band will bring those teeth together. So you can see that change in the front view here. And then you can see kind of the before and after, the effect of the rubber bands for bringing the teeth together. The next thing that rubber bands can do is help retrain the muscles. So your jaw and your muscles are so used to biting in a particular way. After your jaw is moved with surgery, your muscles still want to move the jaw in that direction, the direction that it's been used to for so long. So using rubber bands to retrain the muscles and show them, okay, this is how the bite is supposed to fit together. Here's how we want to retrain the muscles so that the bite stays the way the surgeon has placed it. This is how rubber bands can help with that. So I'm going to show you another little video. Let's say the bite used to fit together, something like this. So now we wear rubber bands to help guide the muscles and retrain them so that the bite fits together the way that we want it to fit after surgery. So that's what the rubber bands will do there. What else is important after surgery? Well, one of the most important things after surgery is oral that's important is oral hygiene. We want to make sure you're keeping your mouth very, very clean and reducing the likelihood and risk of bacteria and infection that could happen. So how do you do that after surgery? Well, you can use specific tools to help keep the braces clean. So one of them is called a water pick. So this is a very useful tool. Some of you may have a water pick. It's great to use. If you don't have a water pick, you can use anything to help flush out the braces, help keep things clean. The thing to know about using a device like this is that you want to make sure you keep it on a lower setting, and when you're angling or positioning the part that squirts the water, you don't want to squirt it up towards the incision areas. You want to squirt it down towards the teeth so that you're not pushing water into area that shouldn't be having it. The other thing that's useful is called an end-tufted brush or a proxy brush. You can see that in the bottom picture here. So it's a little bristle brush, if you will. We've got some here, so if you want to pick up a sample at your orthodontic appointment, just ask for one. And these are useful, like the picture shows, to go in between the braces, underneath the wire, and get all around there so you're able to clean it. The next thing that's important after surgery to know about is the sleeping position. So the surgeon will talk to you a little bit more about this, but if at all possible, we'd like to have you prop up with a few extra pillows so that you're able to stay more upright, so that any swelling that may happen can resolve faster. If you're a little bit higher up, then the swelling will go down quicker, versus if you're laying back, you get more blood flow to the head and neck. The next thing to know about after surgery is you want to have a 1 to 3 week follow-up appointments with the orthodontist. So either myself or Dr. Glick will want to see you back very frequently, so that we're able to keep track of rubber bands, we're able to make sure that the bite is fitting together well. If you travel from a distance and that's not possible, of course there's always exceptions that we can make and work with everybody's schedule, but ideally 1 to 3 week follow-ups after surgery. And you can plan that you got at least 3 months of braces remaining after surgery, usually more, but the quickest is 3 months. So you plan that you're still going to be in braces for a while. Okay. The next piece: how do you eat after you've had surgery? So we've got a couple recommendations for that. So one is, if you use a squeeze bottle, something like this, or like a ketchup bottle, if you're having a smoothie or something, if you put it into that and then place it like kind of on the side, it's easier to squeeze that out. It's often hard to develop good suction, and or the surgeon may say don't develop a lot of suction, don't suck through a straw, because it can dislodge blood clots and things like that that are important for healing. So sometimes squirting or having something that you can squeeze and squirt into the mouth is helpful. These are easily available, like a ketchup type bottle. The dollar store often sells them, so it's a great place to pick up some of these. There's also a nice cookbook that's available online. It's called the No I Can't Chew Cookbook. It's got some great recipes for softer foods, soups, things like that that may be helpful if you want to check that out. So now the big question that I always get asked is, how can I get finished? Now I've had my surgery, I've had braces on for years, when can I get done? What do I do to help me get out of braces and be done with this faster? So there's 3 really simple rules or tricks to help get done with braces faster after surgery. So number 1, wear your rubber bands. Wear them exactly how you were told all day, depending on what your orthodontist tells you. Tip number 2, keep your mouth clean and healthy. Make sure you're brushing, make sure you're using your water pick or whatever other tools you've got to keep your mouth as super healthy and clean as you can. And then number 3, don't miss your appointments. Make sure you're here when you're supposed to be here and following all of the directions, and then Dr. Glick and I will work really hard to get you out of your braces. That is it for orthodontics. Any questions?